Doctors are voicing concern over what the U.S. slashing childhood vaccine schedule could mean for other countries, including Canada. This week, the U.S. Centre for Disease Control and Prevention began recommending all children be vaccinated against 11 diseases instead of 17. Now, those changes come after U.S. President Donald Trump ordered a review of the country's vaccine guidelines. And for more on that decision and how we could be affected, we're joined this morning by Dr. Fahad Razak. He's an internal medicine specialist at St. Michael's Hospital. Good morning.
Morning.
So the U.S. Department of Health and Human Services says the country is a, quote, global outlier in how many diseases children are vaccinated against. But when you take a look at the Vaccine Integrity Project, well, this is something different. Children in most high-income nations are vaccinated against 12 to 15 diseases, 15 in Canada. What evidence is the U.S. basing its new guidelines on?
Yeah, look, they say that they're comparing themselves against other countries, but the reality is they picked one single country. They picked Denmark as their example. Denmark does only have 11 recommended vaccines, but Denmark is fundamentally a very different country. It's only 2% the size of the United States, 6 million people in Denmark. It's very homogeneous. It's very wealthy. They have a universal healthcare system, and they have probably the best healthcare and public health data in the world, which means they can track people who have infections and prevent infections before they spread further. So to use that as a comparison for a country that's over 350 million people, where over 30 million people don't have insurance, where there's huge variation between states in the United States in access to vaccines and vaccination rates, it's really, really not a good comparison. And in fact, Danish health scientists and their public health officials have said, we're not a good comparison for the United States, don't use us.
Yeah, so it's not even like apples to oranges, it's like apples to watermelon.
That's right.
Among the vaccines no longer fully recommended for U.S. children are influenza, COVID-19, RSV, hepatitis A and B. You know, we know that at least those first three can be very common in children. So if immunity levels drop in America, are we as Canadians at greater risk?
Yeah, first of all, about the effectiveness. Look, these are incredibly important vaccines. And just to put this in context, the U.S. government, the Center for Disease Control, their own estimate from their own scientists is that in the last 30 years, these vaccines, childhood vaccination in the United States has probably saved over 1 million lives. 1 million deaths of children have been prevented in just 30 years. And even if you don't die, these are very consequential infections. Their estimate is that over $2.5 trillion has been saved by the use of those vaccines. So that's the first thing. For Canada, unfortunately, this is the latest example where, and I was struck that our health minister said this publicly just in December, that we probably can't rely on the United States for scientific and health information the way we historically did. It means, for example, because of our large shared border with the United States and many people going back and forth, people have to be more worried now about exposure to infectious disease if you're traveling to the United States, if people from the United States are coming into Canada. And it means we probably need to work with other countries that are more like-minded, like in the European Union and Australia and Japan, other places that look at scientific and health information the same way we did.
The same day that the CDC issued those new guidelines, the U.S. recorded its worst flu test positivity rate in 25 years. So how does that square with what the U.S. is now recommending?
Yeah, look, it's striking. They're undergoing probably, if you look state to state, one of the worst flu seasons in history in the United States right now. We know that vaccines are one of the most important things you can do to prevent severe illness from flu. By some estimates, more than 80 to 90% of all children who end up in hospital with critical illness with flu are unvaccinated. So it's an incredibly important vaccine. So in the middle of that, to pull the strong recommendation for the use of the influenza vaccine is very, very striking.
You know, on this show, we have both reported on the findings and spoken to doctors about the concern of increasing vaccine skepticism in Canada. The CDC is the world's largest government health agency. So could the U.S.'s decision fuel more vaccine hesitancy in Canada? Are you already seeing this in offices?
Well, look, the recommendation just came out, but the broader point about the impact of misinformation, disinformation, and the impact generally of the United States as this anchor country and institution. Look, I say this with great sadness. I, like many other Canadian scientists, spent significant time training in the United States, learning from the best scientists at the best institutions. And now to see this happening, I think, is extremely sad. And yes, this is a very difficult climate for misinformation and disinformation. I see it every day in my clinical practice. I see it in the responses I get to interviews. And it's hard when the largest, most important country in the world is shifting in this very significant way.
Dr. Razak, internal medicine specialist at St. Michael's Hospital. Great to have you on this morning. Thank you.
Great to see you, Amber.